So, I mean, I think OREF's has had a major impact in my career. At the beginning, in the late 90s, I received an OREF Health Services Research Fellowship, which really allowed me to go to the Harvard School of Public Health and get a master's degree in epidemiology. The thesis for that project was a clinical prediction rule to differentiate septic arthritis and transient synovitis of the hip in children. And that work eventually led to an OREF Clinical Research Award, which is a major award in the field of orthopedics. Along the way, over the last 15 years, I've received a few OREF research grants, which have really helped establish my research career. This most recent grant that we received is a grant to develop a functional activity scale for children and adolescents. And I think that's really important. Kids and adolescents are very active when they have an orthopedic injury, say they fracture their tibia or they tear the ACL in their knee. Their main goal, and one of our main goals, is to get them back to activity. So the question is, how do we measure that scale? How do we measure their activity? Right now, we're kind of left with adult scales that we use in kids and adolescents, and that's problematic. We don't use an adult blood pressure cuff on a kid. Why should we use an adult outcome instrument on a kid? Kids' comprehension is different. The questions may not be relevant. They may have some technical jargon, and so our goal is to develop an activity scale so that when we do an orthopedic intervention, we can see what level activity we're returning those kids to. Yeah, I think adoption really happens sort of in stages. I think the first is, getting this new scale out there in terms of research presentations and publications. And then I think the orthopedic community in general kind of gets it that, adult instruments may not be appropriate for children and adolescents. And we really need to point out what are the deficiencies with the current instruments, why they may not be applicable to children and adolescents, why we developed this instrument, and then give the numbers. What was its reliability? What was its validity? What was its responsiveness? And then I think it really becomes the de facto instrument. If you're presenting or doing a study and you're looking at activity and you're not using an instrument appropriate to that population, well, that's a problem. And now there will be one that's available and appropriate for that population. So we hope that it's widely adopted. Our field is really driven by research and by innovation, and that's never been more important than it is today. I think the government, the payers, our hospitals, patients, their parents, they want to know what our outcomes are. They want to know what our comparative effectiveness is to other treatments. And the unfortunate thing is we don't have a lot of good data for much of what we do, and that data is going to come from good, high-quality research, and that has to be supported somewhere. I think it's hard for us as orthopedic surgeons to be competitive, sometimes particularly with respect to clinical research on major national grants like at the NIH, and so for many of us that are doing clinical research in orthopedics, the OREF has been essential. I think I just found out I've been an Order of Merit donor for more than 10 years now, and so I think in our department feels that it's very important to give back to OREF. It's done a lot, again, as I said, for my career, and it's done a lot for many in our department. And so I think it's important to support that research in addition to receiving grants to do that research.